Hello, everybody, and welcome back to this week's episode of Medisodes. Now, this week we're going to be tackling a medical condition that is extremely serious and, in most cases, is an emergency that requires immediate medical attention. Today we are talking about stroke. But first off, what is a stroke? A stroke is a serious, life threatening medical condition that happens when the blood supply to a part of the brain is cut off. These require urgent treatment, and the sooner a person receives that treatment, the less damage is likely to happen. There are actually different types of stroke, and there are three main ones: ischemic strokes, hemorrhagic strokes, and transient ischemic attacks, or TIAs. An ischemic stroke is the simplest and most common type of stroke, which is caused by a blockage cutting off the blood supply to the brain. A hemorrhagic stroke is caused by bleeding in and around the brain, while transient ischemic attacks, also known as mini strokes, are the same as a normal stroke, except the symptoms only last for a short amount of time, because the blockage that stops the blood getting to your brain is temporary. These blockages can be extremely deadly to the brain, as it can lead to the death of brain cells. If the blockage persists for a long period of time, the brain cells can eventually die, and they won't always regenerate back. This can lead to people having serious degenerative conditions after having stroke. But what causes strokes in the first place and causes these different types of stroke? For that, I'm going to pass on to Shrey.
Okay, so as Anupam mentioned, there are three main types of stroke, and all three can be very deadly. So we obviously want to see what can be done to make sure that we avoid the risk of getting these strokes. So the main risk factor is high blood pressure, and actually many of the risk factors are interconnected. So high blood pressure damages the walls of the arteries, and that leads to plaques being deposited in the artery walls, and that causes an artery to harden and narrow. You may remember from our previous videos we talked about the development of atheromas, and this is what this is. It's atheromas developing in the arteries. This causes, if this plaque were to break off, that would cause a blockage in the artery. If that blockage happens in the brain, it's a stroke. High blood pressure also increases the likelihood of a hemorrhagical stroke, because the high blood pressure can cause the artery to burst, especially if it's weakened. About half of all strokes are associated with high blood pressure, and if you have hypertension, which is high blood pressure, you have double the risk of having a stroke. Something that contributes to this, the increased risk of this, is high cholesterol. So high cholesterol will cause the plaques that are deposited in the artery to develop faster, because one of the main substances within these plaques is cholesterol, specifically LDL cholesterol. Also, having excessive alcohol will also raise blood pressure, and it also means you're more likely to develop type 2 diabetes, which is another risk factor. So diabetes increases your risk of hypertension in itself. For type 1s and type 2 diabetics, the body can't make enough insulin. Hyperglycemia is when your blood sugar levels are above 6 millimoles per liter, and this high blood glucose level damages the blood vessels and causes the development of atheromas and therefore blood clots later on. About 2/3 of strokes in people with diabetes are related to hyperglycemia. However, this can be controlled with good glucose control. So by injecting the right amount of insulin every day and keeping those blood sugar levels in check, you should be fine. Another risk factor is atrial fibrillation, which are irregular heartbeats. So what happens is the chaotic heart rhythm with atrial fibrillation can cause the blood to collect in the atria, which are the upper chambers of the heart. And in there, they can form clots. And if these blood clots were to break free from the heart and travel to the brain and then cause a blockage there in one of the arteries there, that would cause a stroke. And people with atrial fibrillations are 5 times more likely to have a stroke. About 1 in 7 strokes is associated with atrial fibrillation. excessive drinking of alcohol can lead to atrial fibrillation. Alcohol also causes liver damage, which actually stops many of the clotting factors from developing. And you might think that, oh, if clotting factors aren't made, then it's less likely to have a stroke. However, it does increase the risk from hemorrhagical strokes, because obviously that blood will not clot after the artery is burst, and you'll lose a lot more blood, and it's probably going to be very deadly. And actually, they found that having more than 2 drinks a day means you'll have a stroke 5 years sooner than you otherwise might have done. Smoking is another thing that can increase your risk of having stroke. That's because nicotine increases your blood pressure. Again, that's another thing that increases blood pressure, and blood pressure is the trigger cause of this. And also, chemicals in cigarettes, apart from nicotine, can damage the artery walls, and that leads to doubling of the risk of a smoker having a stroke compared to a non-smoker. Also, the carbon monoxide in cigarettes binds to hemoglobin, so that means less oxygen is available in the blood, and that also, if you have a stroke, that can make it worse. So these are all modifiable factors. This is caused by behaviors, but there are some non-modifiable factors that, although we can't change, we need to be aware of. Firstly, age. You're far more likely to have a stroke if you're over the age of 55. However, 1 in 4 strokes are still in people of younger ages. If you have a family history of strokes, so if your brother, your mother, your sister, your father, your grandfather, your grandma had a stroke, you're far more likely to have one. And that's due to a combination of lifestyle factors. You're more likely to have unhealthy lifestyles because that's what led to them having a stroke. And also there are some genetic factors as well. Also ethnicity. South Asians, Africans, Caribbean people are more likely to have a stroke, and this is due to the fact they have higher rates of type 2 diabetes and higher rates of hypertension, which are obviously risk factors for stroke, and therefore will increase your likelihood of having one. Also, medical history, in terms of your personal medical history. So, if you had a stroke in the past, if you had a mini stroke in the past, or if you've had a heart attack in the past, you're far more likely to have a stroke again. So, I hope that's a good roundup of all the risk factors. Now let's move on to Surya, who's going to talk about statistics regarding strokes.
There are more than 100,000 strokes in the UK each year, causing around 38,000 deaths, making it a leading cause of death and disability. In the UK, there are over 1.2 million stroke survivors, with 2/3 of survivors leaving hospital with a disability. This leads to an estimated cost of £26 billion a year. Public Health England data suggests that the average age for someone having a stroke is decreasing, with over 1/3 of strokes in adults between 40 and 69 years of age. Every year, around 400 children in the UK have a stroke, according to the Stroke Association. It is estimated that 7,000 strokes could be prevented and over 2,000 lives saved every year in England if people with atrial fibrillation were adequately treated. People with atrial fibrillation are 5 times more likely to have a stroke, and more than 1.6 let me do that bit again. People with atrial fibrillation are 5 times more likely to have a stroke, and more than 1.1 million people have a diagnosis of atrial fibrillation in England. In England, 1 in 6 people have a stroke, so it really is quite a prevalent disease. Now I'll pass on to Adrian, who will be talking more about the medical treatments and interventions for stroke.
So now I'll discuss some treatments against stroke. As Anupam discussed, there are different types of stroke that can occur, and different types demand different treatment measures, though in general they are very similar. First, I'll go through some ways that doctors treat ischemic strokes. Around 12% of people with an ischemic stroke are eligible for clot-busting treatment, which is formally called thrombolysis. Medications are prescribed to dissolve dangerous clots in blood vessels that are blocking the blood supply to the brain. Usually these medications have to be prescribed within 5 hours of the onset of stroke symptoms, so that they can act in time to reduce serious brain damage. However, not all patients who suffer an ischemic stroke are suitable for thrombolysis. A scan provides valuable information as to what type of stroke the patient has suffered, as well as whether thrombolysis is a suitable treatment for the patient. There are several reasons why a patient may be deemed unsuitable for thrombolysis treatment. Some of these include the cause of the stroke not being a clot, not knowing when the stroke symptoms began, if the patient suffers from a bleeding disorder, or if the patient is on medications that are not compatible with thrombolytic medication. After thrombolysis, about 10% of patients recover with no significant disability. There is also a chance that a thrombolysis can cause bleeding in the brain, meaning that 1 in 25 patients undergoing thrombolytic treatment will have to be treated for brain bleed afterwards. As with all treatment, doctors carefully balance the risk to the patient against the potential benefit of treatment. Another way of treating a stroke is thrombectomy. This involves the mechanical extraction of the blood clot using a clot retrieval device. This is done by inserting a mesh device into an artery in the groin, moving it up to the brain and pulling the blood clot out. This process can be used in stroke cases where the clot is in a major artery, which constitutes about 10% of all ischemic stroke cases in the UK. Thrombectomy is a relatively new procedure, however, and is gradually becoming more available in stroke centres across the UK. If left untreated, the blood clot will usually break up naturally within a few days. The patient will be given treatment to reduce the risk of another stroke occurrence. This includes blood thinning medication and medication to reduce blood pressure. In a very small number of cases, an operation may be needed to relieve pressure on the brain. When the brain is injured, tissues can swell, not dissimilar to a bruise. If there is copious swelling, there is a danger that the pressure on other parts of the brain is increased, and this causes further damage to those parts. In this case, the procedure that is carried out is called decompressive hemiocraniectomy. This involves opening up a section of the skull to allow the brain to swell outwards and thus reduce the pressure on other parts. The first 24 hours after a stroke are critical in terms of the long-term recovery of the patient. The team on the stroke unit will continue to monitor the patient for at least 24 hours to ensure that they remain stable. After a stroke, the patient is given a swallowing test, as it plays a key role in the medication that are prescribed, as well as the food given in the hospital. It can be dangerous to give the patient fluids, food, or oral medication if they are having trouble swallowing. If the patient is still showing lasting effects after 24 hours, they will need a full assessment by all the stroke team professionals, who together decide the best course of action for the patient. Stroke can lead to permanent loss in abilities such as walking and talking, and so many stroke patients will have to go through stroke rehabilitation therapy to help them recover to a pre-stroke state. This may include speech therapy for those struggling to speak, or physiotherapy for those struggling to move properly. Every patient recovers differently, with some recovering completely, whilst others may be left with lasting problems or a disability. The fastest recovery is during the first few months after a stroke. Following that, progress is usually slower. Although brain cells that have been severely damaged by a stroke can't grow back, other parts of the brain can learn to take over the jobs that the damaged parts once did. And this is an example of neuroplasticity. For more information on neuroplasticity, be sure to check out our previous episode covering that. So now I'll hand over to Anupam to wrap up today's episode.
Hopefully throughout today's episode, you've gained a deeper understanding into what strokes are, how they work, and how they can be treated. And most of all, remember that strokes are extremely dangerous. So if you see any of the symptoms of stroke in either yourself or other people, seek medical attention immediately. As always, thank you for watching Medisodes, and be sure to stick around next week as we upload videos every Friday. Thank you for watching. Remember to like, comment, subscribe, and share the video, and goodbye.